Fighting for healthcare is really personal for all of us, so I'm going to share my personal story now. My name is Linds Jakows, and I live in Manchester, New Hampshire, just a couple blocks that way, actually. And I am a female assigned at birth, non-binary transgender person, which means that I do not identify as wholly male or female. I have worked in New Hampshire as a political organizer, and I've been classified as an independent contractor for a little over 2 years now. I only had access to a quality health plan due to the provision in the Affordable Care Act that young people can stay on their parents' health insurance until age 26. This would have been much more expensive if I had to buy my own plan outside of that. Shortly after I took my current job, I realized that I needed top surgery, a double mastectomy for my gender dysphoria. Ever since I started puberty, I was extremely uncomfortable with having breasts. I knew that I didn't identify as male, but I didn't know that there was any in-between option, that I didn't have to pick male or female until I was about 23. Even then, I didn't know if I could get surgery as a non-binary person. When I did find stories of other non-binary people getting top surgery and saw pictures of their results, I would sob with joy and envy at the idea of my chest looking like that. I wore a binder, which is a tight undergarment used to flatten your chest, for almost 2 years. It made me a lot more emotionally comfortable and confident around other people, but binding is not a healthy option for long term. It can be dangerous for breathing and really bad for your back and rib cage. Fortunately, my mom's plan did cover about 50% of the total $8,200 in costs. I was able to save, I pet sat in my free time, and I secured the funds to get surgery in April 2016, just a month before I turned 26 in May of 2016. Now that I'm post-op surgery, my mental health is better, my anxiety, depression is better, and I feel like all the options for how I present myself and my fluid gender identity are completely open. It might seem a little confusing to some people that I'm actually more often leaning more femme now, that I've gotten surgery and not trying to pass as male more often, but I feel so much more comfortable and confident presenting myself in anything now. And I can focus a lot better on a lot of other important relationships in my life, my job, poetry, now that dysphoria is a voice in my head that's a lot more quiet these days. I feel a lot more at peace with just being a person, even at times when people slip up on my pronouns or otherwise don't see my gender for exactly what it is. This would not have been possible without the Affordable Care Act. These surgeries are life-saving for many of the over 1.4 million transgender adults in this country.